So I was driving home earlier this week listening to the Dan Bongino podcast in my car, and I hear this.
Because what did we find out yesterday? Well, we found out yesterday, if you read this op-ed in the Wall Street Journal, which is amazing, by the way, by Casey Mulligan and Tomas Philipson. Brilliant article. How, you seniors out there, Biden's taking his victory lap on Medicare. Hey, man, I saved you a few bucks on insulin. Really? Price controls? Those have never worked. I warned you about that, but we'll leave that for another day. He saved Medicare? That's fascinating. Because Casey Mulligan and Tomas here note that the Inflation Reduction Act comes for Medicare. It's going to cut your benefits, increase premiums, and upset millions of elderly voters right before the election. Interesting, because that wasn't in that tweet. Folks, if you have traditional Medicare rather than a Medicare Advantage plan, you are screwed. In a nutshell, what they did is you're going to have a difficult choice in 2025. Either take drastic cuts in drug coverage on Medicare or switch to Medicare Advantage plans that cover prescriptions, but you may lose access to your hospital and doctor in the process. Why? Because the Inflation Reduction Act, in their eagerness, Joe, to do something, they had to institute a form of price controls in there that are now going to make sure your premiums go up. And if you can't afford them, you're going to have to dump your prescription plan. Now, oh, you didn't know that? Why wouldn't you know that? When I warned you what the price controls were going to do to medicine, did we do that? Did we do that on the show? We did. Multiple times. Joe, do you remember that
many
too?
Times. Yes,
oh,
I
we
sure
did.
Do. Yes, we did.
So again,
I would say I have no words for it, but I do. I just don't want to use them in a public video. So what I'm going to do in this video is rip the Wall Street Journal article to pieces. I'm going to shred it point by point and kick it to the garbage bin where it belongs. In addition, it's important to reveal who the authors are that authored this article, because I believe their political background is important and the timing of the article is important and not a coincidence. Right before Thanksgiving, preceding the last full week of Medicare open enrollment, it was no accident. Now, Mr. Dan Bongino, who is a public figure, is no Medicare expert. I hope his listeners know that. He's simply parroting an opinion piece from the Wall Street Journal. And note, it is an opinion piece. While I respect Dan Bongino, I have a serious pet peeve with people who are uninformed or misinformed and spew falsehoods on a public platform with conviction. Back when I had a talk radio show in the Baltimore, Washington area called The Technical View, it's about markets and trading and such. I'm a market analyst by training. One of my competitors was that way. He didn't know the subject that he claimed to be an expert in, but he spoke with such conviction that everyone believed him. I remember spending much of my time undoing the damage caused from his comments, much like this video. If we haven't met yet, I'm Matthew Clausen with MedigapSeminars.org. I understand how confusing Medicare can be. I help people with their Medicare decisions every day. My company is one of the premier Medicare insurance brokerages in the United States, representing our clients' best interests. I work with all Medicare supplement plans and all major Medicare Advantage plans in 49 states. My mission is to help you make an informed decision about your Medicare choices. As I mentioned, Dan Bongino is simply parroting an opinion piece written by the Wall Street Journal, written in the Wall Street Journal. That Wall Street Journal article is the real target of this particular video. I'm going to start with the real meat of the article and its false premise. The article pretends to be an attack on the Inflation Protection Act. While that might be part of the motivation for the article, it's not the only intent. Let me read a short paragraph in the middle of the article, and I quote, "Roughly half of Medicare beneficiaries have traditional Medicare coverage rather than Medicare Advantage plans. These are beneficiaries relying on the standalone Part D drug plans, which are the ones that may be run out of business by the Inflation Reduction Act. Traditional Medicare, also known as Original Medicare, members face a difficult choice in 2025. Either take drastic cuts in drug coverage or switch to a Medicare Advantage plan that covers prescriptions but may not cover the hospitals and doctors who are currently providing care." End quote. Good grief. What would you think If a so-called expert came up to you and said that cotton prices are going so high that textile manufacturers are going to go out of business, but don't worry, it will only impact the sock on your left foot. The sock on your right foot will be fine, so just wear 2 right-footed socks. Of course, you'll walk with a limp. Medicare Part D program, Medicare Part D regulations, deductibles, out-of-pocket maximum, formulary requirements, actuarial equivalents are all the same regardless of whether you purchase your Part D as a standalone product or one that is bundled with a Medicare Advantage plan. They are the exact same thing. One just has a contract to work with an Advantage plan. All are required to cover a minimum of 2 drugs from every category and substantially all the drugs from 6 protected categories, which include cancer drugs, autoimmune drugs, and so on. Most Part D plans are currently robust and cover thousands of drugs, much more than the minimum. That may change. I'll get back to that. The Part D bundled with the Advantage plan does not commingle with the Advantage plan. It has a separate deductible, a separate network, and is not subject to the maximum out-of-pocket of the Advantage plan. In addition, you still have to pay your Medicare Part B premium, regardless of what choice you make. There is nothing in the Inflation Reduction Act that will impact standalone drug plans, but not drug plans bundled with Medicare Advantage plans. They are the same. It's just how you purchase them. Of course, those who've seen my videos on Part D already know that. So right off the bat, it's obvious that the authors of this opinion piece do not understand Medicare and how it is constructed, which is a real good reason not to pay heed to anything they write on the subject. They don't know what they're writing about. But let's not stop there. Let's have some fun. I mentioned I have a lot of respect for Dan Bongino. I listen to his podcast, obviously, but I believe he is out of his realm here. So before I show you what's really going to happen with your Part D plans and what the journal article is really all about, I need to pick on Dan Bongino for a moment and in doing so shed some light on the motivation behind the Wall Street Journal opinion piece. In his podcast, Mr. Bongino asserted that bringing insulin down to $35 a month was nasty price control. Perhaps he forgot about this guy. Prior to leaving office, former President Trump championed a new regulation. It was written by CMS, Medicare, along with an executive order that would lower drug prices and reduce out-of-pocket expenses for Medicare Part D, both standalone and bundled with an Advantage plan, of course. The rule was titled Modernizing Part D and Medicare Advantage to Lower Drug Prices and Reduce Out-of-Pocket Expenses. And this was very early 2019. Now, I believe President Trump called it American Patients First, or he may have had an executive order he called that. I have no opinion on his plan, but the cost of prescriptions, especially insulin, was and is a significant issue with the public. There were just 2 problems with President Trump's effort. First is that it was a big win for the consumer, and so this, like everything else he did, enraged his political opponents. Second is that he lost the presidency, and with it, his ability to defend his accomplishments. The Democrat Party wanted their name on this win, so they suspended the act championed by Trump that would lower insulin to $35 a month and lower the cost of many other drugs. They canceled it and replaced it with the Inflation Protection Act, and now they can say they lowered insulin and other drug prices. In other words, the subject has become a political football. We, the consumers, are in the middle. The left didn't want the right to have credit for fixing a problem that has festered for a decade. If they really wanted to fix it, they had ample opportunity during the Obama administration. They didn't think of it. They didn't try. So they canceled Trump's fix and replaced it with their own. Now, the right doesn't like that the left is taking credit for the fix and are attacking the Inflation Reduction Act and screaming Armageddon. How does it feel to be a political football? In case you haven't noticed, I enjoy being political independent. I'm no fan of the Inflation Reduction Act, but it will not do what the opinion piece asserts. So let's continue. They also write in this article, we estimate that beginning in 2025, plan subsidies, specifically the reinsurance subsidies for the beneficiaries with the most drug spending, will be cut by $30 billion out of revenue that currently totals $110 billion. Something will have to give. The Inflation Reduction Act may prohibit Part D plans from being economically viable, even if it doesn't expectantly ban them, end quote. Really? Again, that can't happen to standalone Part D and not the same plans bundled with your Advantage plan. But will that happen at all? One of the great things about this industry is that there are multiple groups of professional financial analysts whose career is based on analyzing Medicare. Those include analysts at CMS, the Centers for Medicare and Medicaid Services, the analysts at the Kaiser Family Foundation, KFF.org. Lots of good research there. And then there's Mark Farah and Associates and so on. Funny how none of them in any of their reports have identified this problem. So first, let's look at how Part D is structured and how it will change. Right now, Part D has 4 stages. First, you pay a deductible. Keep in mind, most plans only charge a deductible on higher tier drugs. Often generics and common brand name Tier 1, Tier 2 drugs are exempt from the deductible. Then initial coverage, where the insurance company pays on average 75% until your total drug cost, your cost and the insurance companies reach a limit of $4,660. And that's it. That takes you to the next stage. It's the coverage gap. And after that, the costs of your prescriptions is shared mostly between the drug manufacturer in green, Medicare in dark blue, with some out-of-pocket by the consumer. The insurance company in this graph is the lighter blue. The way Part D will change in 2025 is that it reduces some of the insurance company burden in the early stage and increases it in the higher stages. It significantly reduces the cost to drug manufacturers in green and to Medicare in dark blue. And here's the problem. Whatever the insurance company must pay ends up costing the consumer. Cost is not always a dollar amount. In this case, it's more likely to reduce the quality of the plan. That's next. In 2024 and 25, it also adds an out-of-pocket maximum. It's $2,000 in 2025. So that's the out-of-pocket for the consumer. But now here's the tricky part. So according to Kaiser Family Foundation, only 1.45 million people in the United States spend enough on prescriptions to reach that $2,000 limit. And another 400,000 are LIS, low income, who are already receiving aid, mostly from the state. Medicare says there are over 85 million people enrolled in Medicare. Of that, only 1.7%, fewer than 2 out of 100 people, will even reach that $2,000 maximum out of pocket. Will it cost money? The Congressional Budget Office estimates that the Part D portion of the Inflation Reduction Act will reduce the federal deficit by $237 billion over 10 years. There you have it. If you have seen my video on Part D for 2023, you would know that I don't like the 2025 proposed structure of Part D. The problem with the drug costs, as I will address in a moment, stems from the manufacturers, not the insurance companies. It would be more sustainable if the cost of this catastrophic coverage was 60% manufacturers and 20% from the insurance companies. Because again, what comes out of the insurance company ends up coming out of the consumer. Now, the top selling 250 drugs, 7% of the Part D drugs, account for 60% of the total Part D spending. That is where the insurance companies will focus to reduce their costs. What is more likely to happen, if this design structure comes to fruition, is that Part D plans may reduce the formulary they offer down to a bare minimum that's required by Medicare, instead of as robust as they are today. You'll then be more likely to find that your prescription is not on the formulary. You can still appeal, of course. But when you pay for a drug out of formulary, it's like seeing a doctor out of network. The plan maximum out of pocket, price limits, and so on don't apply. It's not going to fall on this chart. You're on your own. And you may also see more plans designed for very specific reasons, like people with chronic diseases or heart conditions. Again, so the formulary can be more focused and meet requirements without much extra. The insurance companies know which drugs are more likely to cost them money and will likely adjust their formularies to reduce their risk. However, I believe that before 2025, this will all change. The intent of the Inflation Reduction Act from a political perspective was headlines. Headline, Medicare can now negotiate drugs. Well, actually only 10 drugs and not until 2026. Headline, we put a $2,000 maximum out of pocket in 2025. In 2025. Headline. By delaying the start of these benefits years into the future, they are much more likely to be abridged before they start. So now I want to go back. I have to directly respond to Dan Bongino's comment on insulin, and that will set up the final shred on negotiating drug prices. Insulin was invented in early 1900s. The patent was given away for free. Is forcing manufacturers to sell insulin at $35 price control? Well, if there was a major storm coming and you were stocking up on food and gasoline, and in that moment of increased demand, the store forced you to pay $50 for a bottle of water, and the same for a gallon of gas. Is a law making such markups price fixing? I mean, supply and demand, right? Technically, that can be called price fixing, just not in a bad way. Pharmaceutical manufacturers have been charging the consumer over $6,000 a year for insulin. Multiple microeconomic studies show that in a fair market, one that reflects the true costs of production and reasonable profit margins, human insulin can be sold at a reasonable profit at a price of $72 a year. Insulin analogs can be sold at $133 per year and still be a very profitable product. That's a far cry from $6,000. The problem is a combination of three forces. One is that 96% of insulin is manufactured by just 3 companies. The second is that the product is a necessity for some to live. It's a your money or your life product. And third, the U.S. government, led by Chuck Grassley in the Senate, had an investigation in 2019 and found that these 3 companies have illegally boosted their prices. They may have colluded to do so and have sued to keep competition away from the market. $35 per month for insulin is not price fixing. It's a remedy to price gouging. And price gouging is rampant within the pharmaceutical industry. In my Part B 2023 video I did just a month or so ago, I discussed the price gouging of Aduhelm, an Alzheimer's drug that was so expensive Medicare had to respond with the largest ever % price increase in the Part B premium. As my video clearly articulated, the entire process of approving the drug was corrupt, and the so-called scientific basis supporting the drug's efficacy was apparently fraudulent as well. $50,000 for a drug that does more harm than good. Then they lowered it to $25,000 when people complained. Can you imagine if this were a Monty Python skit? Hey there, here's a cure for Alzheimer's, and it's only $50,000. But sir, it doesn't work, and it makes my brain bleed. Oh, okay, then we'll just charge you $25,000. The most expensive drug in the United States is over $3 million a dose. The top 10 most expensive drug list starts at over $800,000 a year. Who do they think is going to pay for that? Certainly not the consumer. The laws of price discovery and economics don't come into play in this industry because no one is spending their own money. Okay, next, some quick jabs at the possibly useful idiots who wrote the Wall Street Journal article. Then I'm going to show you who they are in general and why this article came out last week. So they write in the article that, welcome to the fiscal, and I'm quoting, welcome to the fiscal and regulatory nightmare known as government-provided health care, where those writing the rules don't understand the consequences of what they do. Democrats hate that Medicare Advantage has been available as a pseudo-private alternative to original Medicare's single-payer arrangement, end quote. I love, by the way, as an aside, their pseudo-private. Notice they didn't say private, they said pseudo-private. I call it corporate welfare. Did you know that Medicare Advantage plans cost the United States government more than original Medicare, your traditional Medicare? Now, I have over 10,000 clients with Medicare policies, Medicare Advantage plans and supplements. The fiscal and regulatory nightmare is not original Medicare. From a consumer point of view, original Medicare is the best health care in the world. You can see any doctor that accepts original Medicare, and your health care decisions are between you and your doctor. No interference from the government or private industry. With a supplement, you can lower your annual financial out-of-pocket from Medicare bills to less than $300 a year. To many Republicans who speak before thinking, and I hate to be political, but that's often what happens, they cry out that they don't want the government involved in their health care decisions. Well, I agree. I don't either, and I don't know anybody that does. And with original Medicare, they aren't. But with a Medicare Advantage plan, it's the insurer that takes on the same role that the Republicans fear would be played by the government. They play God with your health. The insurance company has the ultimate decision to approve or deny your doctor's recommendations. It's a power that's been abused regularly, and it's been called out for abuse in 2 separate reports by 2 separate inspector generals in 2018 and 2022. It's an abuse that I have witnessed more times than I can count. CMS could eliminate all Medicare Advantage plans today, 3,998 of them, and overnight it would reduce the financial burden on the government and improve the quality of health care for the consumer. And you want to argue that private is better? When private has access to a cornucopia of government funds, the result is corruption. A regulatory nightmare? Advantage plan insurers have been abusing the system by overcharging the taxpayer for over a decade. The regulatory agencies know it and do nothing about it. It's not their money after all, it's the taxpayers. They had to be sued just to disclose the abuse and the fact that they've done nothing about it. Medicare Advantage plans are the fiscal and regulatory nightmare that the Republicans fear they would have found in original Medicare. Instead, it's within their own Medicare Advantage plan Frankenstein construction. But they get so caught up in this idea that everything private is better than anything government that they don't stop to look at reality. They don't stop to question their own assumptions. Reality is that our healthcare system is neither government-controlled nor a private free market capitalism. It's a system of corporate welfare and backdoor deals. It's one where no corporate crime is penalized and political donations will buy off a vote to push an agenda based on profit. With original Medicare and a supplement, you can put all of that aside. You can escape it. You're shielded from the politics and, in part, corruption. You and your doctor control your health care. Last point, who are these brilliant analysts that wrote the opinion piece? And why did they write it now instead of months ago when the Inflation Protection Act was in Congress or when it was new? And why didn't they just look at the plethora of research already published by industry experts? The only economic data in the entire piece is a reference to a $30 billion cost without reference. You know, where did they get that information? And without indicating over what time frame. Now, I'm no spring chicken, and I stopped being young and naive about 40 years ago. Something doesn't smell right about this. Both authors are from the University of Chicago. One is a professor in economics. The other they did not credit as being a professor, they just said economist. So there's no excuse for such poorly researched work. They're also associated with the Committee to Unleash Prosperity. Now, it's a right-wing, right-leaning, whatever you want to call it, Republican group that writes a lot of articles and makes a lot of political donations. And that wouldn't be a big deal, except they're vulnerable to groupthink. And that makes them easy targets as potential useful idiots if someone can push their ideology buttons. My gut is telling me that they were handed this information, handed the idea for this article from someone in the Medicare Advantage community, someone who profits from Medicare Advantage Plan sales. The idea behind publishing it now is that it can cause a panic just before the end of Medicare annual enrollment. It's frightening news, and you must act now or the world will come to an end. It was timed so that there is little time to publish and disseminate a rebuttal, and in hopes of scaring people to drop their original Medicare for an Advantage plan while they still have a few days left. I believe that attacking the Inflation Protection Act was a secondary goal of the article. Scaring people out of the traditional Medicare was the primary goal. Now, to Dan Bongino, we're neighbors, sort of. My office is in Palm City. I live about 30 minutes south of that. I invite you to have a more constructive conversation on the subject. It would benefit yourself and everyone involved. Reach out to me if you're so willing. Prescription drugs and Medicare will be a political football in the years ahead, and it may be good to have a reliable source of information. I'm Matthew Clausen with MedigapSeminars.org. Thank you for watching.